Hi, my name is Taylor Ford. My presentation is on the importance of health and interpersonal communication. I will be discussing my article on how deaf patients say it can be difficult to communicate in the hospital. First, I'd like to bring up the concept of why health communication is important. In Chapter 1, we discuss the 6 important issues of health communication. First, communication is crucial to the success of healthcare encounters. Second, utilizing mass media can help people learn about health and can minimize the influence of unhealthy and unrealistic media portrayals. Third, communication is an important source of personal confidence and coping ability. Fourth, effective communication saves time and money. Fifth, communication helps healthcare organizations operate effectively. And finally, there are a various amount of career opportunities in the health field. I would like to go more into depth on the first concept. In the text, it talks about interpersonal communication, which is the verbal exchange of information and feelings between two or more people. This is important and beneficial for the patient because it can lead to an accurate diagnosis when information is disclosed by the client, and it can lead to an appropriate treatment accepted by the patient. The patient can comply with his or her treatment because they understand and are committed to it. Also, the patient can follow up and is better able to maintain his or her health. In my article, it talks about how deaf patients are frequently unable to communicate with their doctors because of a lack of translation services. The services that are provided by the hospitals are insufficient. They use video services where they have translators on Skype or FaceTime, and they are unreliable because of poor quality. Also, interpreters are not provided or they don't stay throughout the entire visit because of the amount they are paid during the time. A deaf patient named Laura Miller said it was difficult to see the video system that doctors use while laying on her back during a C-section. When her 2-year son went under surgery, the translator left in the middle of the surgery, and after the surgery, the doctor just gave her a thumbs up saying everything was okay. If I was in her shoes, I would want to know everything that happened during the surgery. Just a thumbs up is not okay and an unacceptable form of communication. When it comes to health, it can be difficult and frightening for people with disabilities or any disabilities if they are unable to communicate with a health provider because their needs and concerns are not being met. Communication in healthcare is not simply social interaction, but it can affect people's health and even their survival. For example, a miscommunication about a medication can lead to a patient receiving too much insulin or an antibiotic which he or she is allergic to. Also, it can be difficult to understand medical terminology. Poor communication during patient education will result in a patient who doesn't understand how to self-manage a chronic disease. My question to you guys is, how would you feel if you were in a situation such as Laura, where you are unable to communicate with a health professional or hospital staff? What solutions or improvements should be made for people with disabilities to have effective communications with their doctor?